Hearing the words treatment-resistant depression can feel like a dead end, like someone just told you, this is as good as it gets. That's not what that diagnosis means, not even close. Here's the truth. Treatment-resistant depression is not a personality type, it's not a judgment, and it's not a failure. It's a checkpoint. Clinically, it means you've gone through at least 2 antidepressants at the right dose for the right amount of time and didn't get full relief. That's it, nothing more. But here's the part most people miss. That label isn't the end of the road. It's the moment that real options start to open, because standard medications are just the first layer. And for about 1 out of every 3 people with depression, that first layer just isn't enough. So if you've been struggling, you're not rare. You're definitely not out of options. But here's where this gets more serious. When depression doesn't respond to basic treatment, the risk goes up. Energy drops lower, motivation disappears, thoughts get darker, and waiting, hoping the next pill would magically fix this, that's where people lose time they can't afford to lose. Treatment-resistant depression doesn't mean untreatable. It means it's time to change strategy. Now, here's where this changes. Before we even accept that label, a good psychiatrist steps back and rechecks everything. Is this actually depression, or is there something underneath it? Bipolar spectrum, ADHD, sleep apnea, thyroid problems, trauma. If you're treating the wrong problem, the right medication will still fail. Wrong diagnosis equals wrong results every single time. Now you're probably thinking, so what happens next? Is this where things get extreme? No, this is where treatment gets precise. This is what I call the next level path. Instead of repeating the same approach, we move to targeted therapies that work differently in the brain. Treatments like TMS, or ketamine-based therapies like Spravato, or in certain cases, ECT. That's important, but this is what really matters. These treatments exist for a reason. Because your brain isn't broken, it just hasn't been treated with the right tool yet. More of the same doesn't fix resistance, different does. And one more thing, this is not about willpower. You didn't fail treatment. Treatment needs to evolve to match you. So if you've been through multiple medications and still feel stuck, don't sit there wondering. Don't let that label define you. Ask directly, do I meet criteria for treatment-resistant depression, and what are my next options? Because the worst decision you can make right now is trying to figure this out alone. There is a path forward. And for many people, this is exactly where things finally start to change.